Бесплодие в Казахстане является государственной проблемой. Ежегодно около 20 тысяч казахстанских семейных пар получают этот страшный диагноз. За ЭКО же дали Нобелевскую премию, и в мире за 45 лет, оказывается, родилось 8 миллионов людей.
When after 1 year of having all the normal ways of having conceptions, if they are not able to have a pregnancy, yes, they should think about visiting a doctor and finding out reasons what can be that which is affecting their.
То есть, доктор Вупин, получается, дети, рожденные через ЭКО, здоровее детей, которые родились естественным путем. Бесплодие в Казахстане является государственной проблемой. Ежегодно около 20 тысяч казахстанских семейных пар получают этот страшный диагноз. Сегодня мы находимся в Алматы, в клинике ЭКО Miracle IVF. Это международная клиника, основана в Индии, в Мумбаи. И за 18 лет благодаря врачам этой клиники на свет появилось 8 тысяч детей. Доктор Вупин, ЭКО – это оплодотворение вне тела. И я знаю, что 45 лет назад в Англии на свет появилась первая девочка, первый ребенок из пробирки. Луиза Браун, да? Ей 45 лет.
45.
И она сейчас уже мама?
Yes, she's a mother now, a very happy mother.
Вообще, как понять, что у женщины или у мужчины бесплодие?
Whenever a couple comes to us with their difficulties, their problems in life, especially which is related to the infertility. So when such couple comes, and especially when the age is more than 35, then this 1 year category is not concerned. Mostly patient must have visited many of the IVF centers, many gynecologists, many reproductivists to have their treatment. So when they come to us, they are almost fed up. So when a couple comes to us with infertility, so we need to first analyze their proper history. Basically, what they have been through in their life. First of all, the most important thing is to listen to the patients.
То есть после года семейной жизни, если у пары не появляется ребенок, это первый признак того, что, возможно, есть бесплодие.
When after 1 year of having all the normal ways of having conceptions, if they are not able to have a pregnancy, yes, they should think about visiting a doctor and finding out reasons what can be that which is affecting their.
Прежде чем прийти к вам в клинику ЭКО, можно ли вообще попробовать вылечить бесплодие?
IVF is not the only answer for infertility. Any infertility couple, that's why I said, as the definition defines, after 1 year of having regular sexual intercourse, if they are not able to have a child, yes, they should be investigated first by a doctor, maybe gynecologist or a reproductivist, to find out the apt reason.
В какой момент нужно обращаться уже в клинику ЭКО? Да? То есть сколько времени можно пытаться самостоятельно решить этот вопрос?
Ms. Dinara, the thing is that, as I said earlier, most of the patient visits us after visiting almost every doctor in every clinic and then research to us. And that time, yes, we need to offer them IVF because they have almost undergone every treatment under the sky. So if you ask me which couple is supposed to have an IVF treatment, then there are a list of reasons for that a lady should have IVF. I will just like to enumerate few, like a lady who has tubal block or her tubes are abnormal.
Назвать процедуру ЭКО безобидной, в частности вот для женщины, да, сказать сложно, потому что я знаю, что перед ЭКО женщину стимулируют, да, гормональными препаратами. Вообще, насколько это безопасно для женщины?
When we use preparations, as you said, hormonal preparations for a woman going IVF, we use preparations that are safer for a woman, right? And the dose, the duration, everything has been under the international guidelines that should be used for a woman.
Сколько яйцеклеток вы берете за один забор?
Every patient has a number of follicles in her ovary, which we call as ovarian reserve. So a patient who is 25 years old may be having approximately 20 follicles. But a woman who is 45 years old may be having only 4 or 5 follicles. So it depends upon the age and many other factors in that woman.
А если одна яйцеклетка всего, то есть какие шансы?
We can't rate it in a percentage. It depends upon many things. If the sperm is also not good, then the chance is less. If we got one egg from a young woman, that means the egg quality will be good. Chances are good that the egg quality is good. If the sperm quality is also good, then yes, she has chances of having one embryo. But that depends upon many factors. The stimulation which we used and any other diseases the lady is having, any genetic abnormality the woman is having, the age of the woman, how the sperm count and the sperm morphology is.
Чем больше яйцеклеток, тем больше шансов, можно так сказать?
As an IVF specialist, of course, we see the follicle numbers, and if the number of follicles are good, but not only the number matters, the quality also matters. So the quality of follicles should be good, not only the numbers. So if the quality and the number of the follicles are good, then yes, the chances of having more embryos.
А если все-таки проблемы у мужчины, какие шансы зачать эмбрион?
The technology has advanced so much that we can increase the number of eggs in a woman by doing a plasma therapy of ovaries in the woman. In the same way as you asked now about the man, if there is low sperm count. You know, earlier days when there was low sperm count, we used to use ICSI or IMSI.
Это хорошая новость, потому что, то есть, вы можете не просто оплодотворить, да, эмбрион, но еще и проверить, да, качество, чтобы ребенок родился здоровым. За ЭКО же дали Нобелевскую премию, и в мире за 45 лет, оказывается, родилось 8 миллионов людей, которые родились из пробирки, да. И вы внесли в свой вклад, да, 8 тысяч детей родились благодаря вашей клинике за 18 лет.
Yes.
У вас есть все-таки тоже большой богатый опыт. Скажите, пожалуйста, как вообще ЭКО влияет на здоровье ребенка, потому что это тоже волнует очень многих родителей.
The international statistics says the chances of having any congenital abnormality or any abnormality in the baby is very rare with in vitro fertilization or by means any assisted reproductive techniques. As you asked about our team statistics or our clinic statistics of 8,000 pregnancies, though we don't have a follow-up of the whole life of the babies born after that.
То есть, доктор Вупин, получается, дети, рожденные через ЭКО, здоровее детей, которые родились естественным путем.
There is no statistics which says that the baby born with IVF is very weak or the babies born with IVF are very stronger than. What I consider or what the statistics considers is the babies born with IVF are same as the baby born without IVF.
Я знаю, что в вашей клинике, в клинике ЭКО, Miracle IVF, используются какие-то новые технологии, которые в Казахстане еще никто не использует.
IVF is a science which has been continuously changing. The better word to use will be a dynamic science. So every time to time there has been updates in IVF. And we as a team believe that we need to adapt to those changes and get into the practice so that patient benefits from it. As you asked earlier about the technologies for men, as I said, there was ICSI used earlier as a technology, then IMSI and PICSI came. Then later on we are doing MAX now and studying the DNA. So now there are technologies where we can study almost 200 genes in the embryon so that we can find out if the baby is free of having any genetic disease, which basically includes any blood cancers or thalassemia, Down syndrome, any mental abnormality in the baby or any organic disease, by the way, which is caused genetically. We can do this test even without touching the embryo, and that is what is called NACE. So we can find about all the genes, all the chromosomes problems are there or not by just studying the fluid around the fluid in which the embryo grows. So that is called as NACE. And if I tell you something else, now the most important thing what we are following is to have a personalized IVF and using an ERA technology. So there have been many advances. If you ask me, the time-lapse monitor and the AI is artificial intelligence, has actually become a immense. It's become a heaping thing in the success of our laboratories having a success IVF rate.
Я знаю, что в вашей клинике можно сдать ERA-тест. Расскажите, что это?
The most important part of our success is using personalized IVF. Like if 3 patients comes to me in a day, X, Y, and Z. So the treatment I am going to give to X will not be that Y or Z because X is different from Y and Z is not similar to Y. So we need to personalize the treatment. So if the personalized IVF means to have a personal stimulation, personalized embryo transfer and personalized preparation. So if you tell about personalized embryo transfer, earlier the transfer were done on day 3. Then because the success was less, we started doing on day 5, and the day 5 transfer is called blastocyst transfer. Some people were doing transfer both on day 3 and day 5. So if you see, Ms. Dinara, the transfer success rate of having day 5 transfer is around 30 to 50%. Where will the rest 30 to 70% go? Have they lost the scope? The uterus receives the embryo in a time frame. If the embryo is transferred beyond that time frame, uterus will not receive it. If we don't transfer the embryo in this time frame, we may lead to a failure in pregnancy. And this is where ERA comes into picture. So when we do ERA test, we test what is the time that uterus is ready to accept the embryo.
То есть шансов больше, да, когда ты знаешь, в какой именно момент нужно имплантировать эмбрион.
Exactly. So when we do the ERA test, the test will tell me the transfer should be done on 76 hours, or the transfer should be done in 120 hours, or the transfer should be done in 146 hours. Of course, when we combine ERA with all other technologies which we are using in our IVF lab.
Доктор Упин, спасибо вам большое за вашу работу, за то, что делаете все возможное, чтобы казахстанцев становилось все больше и больше. Друзья, если вы столкнулись с бесплодием, это вопрос, который можно решить. Приходите в клинику Miracle IVF. Благодарю.